Hello and welcome to the September Health Conference. I'm Lori Day and I'll be your moderator today. I'm pleased to introduce our first presenter, Setareh Banisadr, and she will be presenting a holistic self-care for lupus. Please remember that this information is provided in these talks today is educational purposes only, and consult your physician before making any changes to your routine. So Setareh is a lupus patient and a longtime volunteer at the Lupus Foundation of Northern California. She's a graduate student pursuing her master's degree in integrative health, and she has held training, sales, and mentorship roles in the healthcare sector for the last 14 years and has 6 years of experience in patient education. She has worked for Fortune 500 companies such as Allergan, AbbVie, and AstraZeneca. Through turning around her own health through healthy lifestyle practices, she's become fascinated by what patients with autoimmune disease could do to help themselves. She received a health coaching certificate in 2013 from the Institute of Integrated Nutrition in New York and has an advanced coaching certificate in 2022 from the California Institute for Integral Studies in San Francisco. She's the founder of Setareh Health, where she coaches clients with chronic diseases one-on-one to help them make their behavior changes they seek to improve their health and overall well-being. We're thrilled to welcome Setareh here to talk to us today. Welcome.
Thank you. Thank you so much, Lori. I just want to express so much appreciation for the Lupus Foundation in Northern California. You guys were the first place where I was able to meet other lupus patients and see people like myself. So I really thank you for welcoming me into this space. So for myself, when I was diagnosed with lupus nephritis in 2001, I was 18 years old, and the whole diagnosis was super overwhelming to me. I had a lot of joint pain. I was exhausted all the time, and I had really overwhelming brain fog. I had no one to really help me, to guide me through this, because I didn't know anyone else that had lupus. I had to see so many different doctors. And I remember that the one question I would always ask at my doctor's appointments is, what can I do to help myself? And the doctors didn't have a lot of answers for me. And at that time, they just told me that I should stick to my medications, avoid the sun, and rest as much as I could. And that was what started me on my own journey to find answers and to experiment on myself to see what helped. My hope is to share with you what I have found to be helpful along the way, what has been transformational for me on my journey back to health. And it truly has been like peeling back the layers of an onion, always learning and adding more along the way. In my graduate training, most of my research has been on finding out what really works for large groups of people that have lupus, as my goal really is to bring that information to those who are struggling. If possible, please grab a pencil and pen and some paper, as I have an exercise that I'll do with you a little bit later in the presentation. And also I want you to be able to take notes if there's anything that you find valuable that you want to try to come back to at a later time. So one idea we talk about a lot in integrative health and in health coaching is the idea that in order for healing and health to occur, the focus must be on the whole patient. And as whole individuals, we have many dimensions to our lives that need to be functioning well for us to thrive. So this includes having supportive relationships, having meaning and purpose in our lives, managing our stress well, taking care of ourselves, movement, and balancing that with having enough rest, nutrition, and adequately hydrating our bodies, and then of course working well with our healthcare team. For people with a chronic illness, it's also particularly important that we are supported and that we play an active role in our healthcare. This means that we put ourselves at the center of our healthcare team, advocating for ourselves, doing our own research, and making decisions alongside those that are there to help take care of us. Also, keeping in mind that no one is going to care as much for our health and well-being as we do. So if you look at this illustration here of our healthcare team, again, we are always at the center of that. And then we have the many different doctors and healthcare practitioners, our primary care doctors, our rheumatologists, maybe we're seeing a psychologist to help manage our mental health. If we're taking Plequenil, we might be seeing an ophthalmologist as well to get our eyes checked regularly. For some of us, we're lucky enough to have a health coach. So, someone to be a support and an ally as we're making behavior changes. Perhaps a nephrologist. I also see a functional medicine doctor, and this is something that usually is paid out of pocket, but can really offer a different perspective on how we can best manage our health. In taking agency over our health, we can start developing the confidence, developing healthier behaviors to take care of our own health instead of relying on others to do that for us. Having worked in the healthcare industry for over a decade, we often talk about patient activation and the importance of patients taking an active role in their own healthcare. So this is an illustration of the 4 levels of patient activation. In level 1, the patient is disengaged and overwhelmed. Their perspective is, my doctor is in charge of my health. In level 2, the patient is starting to develop awareness, but might still be struggling in some areas. They may have some knowledge, but maybe they're still having some gaps in what they know, and they believe that their health is largely out of their control. They can set some simple goals, and their perspective is, I could be doing more. In level 3, the patient is starting to take action. They have some key facts in place, and they're building skills to manage themselves. They strive for better behaviors. They become more goal-oriented, and their perspective is that I'm part of my healthcare team. In level 4, patients are maintaining behaviors and they're starting to push forward. They're adopting new behaviors. They may still struggle in times of change if they get a new diagnosis or something like that. But the key is that they're maintaining a healthy lifestyle, and that is their main focus. And their perspective is that they are their own advocate. So the goal for all of us as patients, and this is the goal of our healthcare providers as well, is for us to move through these levels and to be at a level 4. And at level 4, as I mentioned, we're really actively involved in our own healthcare, and we're using self-management skills like having a nutritious diet, moving our bodies every day, taking our medications, managing stress. We're doing all these things for ourselves in order to increase our health and our well-being. And as I mentioned, many of us have been in different levels at different times. So there's no judgment here on where you're at with your illness. And at times we may even revert back to one of the previous levels if we have new symptoms or perhaps we have a new diagnosis. Studies have shown that being more activated in our healthcare, so perhaps being at a level 3 or a level 4, can result in fewer medical errors, better coordination between the healthcare professionals that work with us, and a less likely chance of being readmitted to the hospital within 30 days of a hospital stay. So the question is, what do we do to get more active in our care and in managing the behaviors that help lead to better health? The first is increasing our level of knowledge regarding the condition that we have, the medications we take, and what our options are for our health care. It's a good practice to write down questions before appointments and have somebody there to support you. It's so easy when we're in a doctor's office to kind of go blank on what we wanted to talk about. And a good tip is to keep notes somewhere. Maybe it's a notebook, or maybe in your phone, you just open up the notes section and go in there. And whenever a question pops up into your mind that you want to ask during your next doctor's visit, you put it in there. And then having that person there to support you, make sure that you get all your questions answered, but also that you have a second set of ears to really listen to what these answers are. That's always helpful. Asking your doctor about lifestyle changes you can make to support your condition. So these days, the average doctor's appointment is about 7 minutes. It's really hard to believe, but with the amount of things that doctors have to cover in the doctor's appointment, the patient load that they have, really the amount of time that they spent with you needs to be maximized. And in my opinion, you really need to use that time to get your questions answered. And that can be about, medications and the things I mentioned, but also maybe about, you want to ask about starting an exercise program, or you want to ask about a dietary change that you're looking to make. The doctor is really not going to know to talk about these things unless you bring them up. Adopting and seeking support on making these behavior changes, maybe even outside of your doctor's office, is really important as well. So whether it's a friend or a family member, or you want to get professional support like a nutritionist or a coach, a lot of those things are really up to you to bring those sources of support into your care and into your life. When I was first diagnosed with lupus, there was really not a lot of information out there on what diets work best for lupus. The goal of diet for lupus patients should be to eat food that is nutrient dense, which will optimize health and energy, and also eat in such a way that'll help us avoid cardiac issues in the future that we're especially prone to. Now, these days, there are books, there's articles, there's even studies being conducted to see which type of diet is optimal in achieving these goals. For lupus patients, optimizing our diet includes both what we eat as much as what we avoid. I'll start by talking about what we should avoid, because oftentimes by cutting out these specific foods, we can feel a dramatic difference in our symptoms. Many experts believe, and some studies suggest, that everyone with autoimmune disease has a condition called leaky gut syndrome. Leaky gut is a condition in which the lining of the small intestine becomes damaged, causing undigested food particles, toxic waste products, and bacteria to leak through the intestines and flood the bloodstream. When these foreign substances enter the blood, they can get lodged in an organ or a joint, and they can cause an inflammatory reaction. This autoimmune response causes inflammation in the body, and it can lead to just overall inflammatory conditions, migraines, irritable bowel, chronic fatigue, joint pain, eczema, and more. And there are certain foods that are found to trigger this autoimmune reaction more than others. And the foods that typically trigger these autoimmune reactions are gluten, soy, and dairy. And for this reason, diets that avoid gluten, soy, and dairy are the least inflammatory for those who have autoimmune disease. And the theory of leaky gut, when, several years back when I first heard this information, it was contested a lot by conventional medicine. But these days, you can find information about it, and you can find that it's being studied and recognized as something, a real phenomenon by the Cleveland Clinic as well as Harvard Health. So since everyone is unique, it's hard to just put a one-size-fits-all diet for everyone, saying, if you avoid these 3 things, then you will have optimized your diet to best support your illness. Some people may not have a reaction to any of these foods, and some people might have other foods that are triggering their symptoms. And these are commonly things like nightshade vegetables, corn, or even red meat. So there are food sensitivities and there are food allergies. True food allergies can cause things like hives, swelling, itching, or anaphylaxis. So we all know about these. We hear about someone who has like a peanut allergy or an egg allergy. A lot of times it's children that have really severe reactions to these foods. However, food sensitivities are more subtle in their symptoms, and they typically can cause things like gas, bloating, constipation, acne. And again, we're seeing consistent levels of inflammation in the body in reaction to these foods. Now, there are tests that you can do. Usually you would get them from a naturopathic doctor or a functional medicine doctor, where they will do a blood panel and they'll take a look at all the different foods that you might have a sensitivity to. But really the gold standard, and in the end, what they will always recommend to you is what's called an elimination diet. So an elimination diet is a diet in which you take all these potentially offending foods, so the gluten, the soy, the dairy, and the corn, out of your diet for 3 weeks. Stop eating them completely. And then one by one, you start introducing these foods back into your diet. So perhaps the first one you want to add back is dairy. And you're going to eat something with dairy about 3 times a day for 1 or 2 days, and then see if you have any new symptoms. So maybe your joint pain comes back, you find your energy is in a slump, mental clarity, mood, congestion, all of these things can be affected by foods that we are sensitive to. By reintroducing the foods one by one, you can really look and see how that food is affecting your body. For myself, I went through an elimination diet and I found that I was particularly sensitive to gluten. So when I removed the gluten, my joints stopped hurting. When I added it back, they started to ache again. So now I've completely removed gluten from my diet. It was a little hard to do in the beginning, just to find alternatives for everything from all the foods I love, bread, tortillas, pasta, all those things. Gluten is actually found in a lot of different foods. It's in a lot of like processed foods and dressings because they add wheat to kind of bind things together. You can find it in bread, cakes, cookies, pasta, cereals. Those are all the obvious places that it's found. And finding alternatives really made it a lot easier to live a life without gluten, and also a life where I wasn't having joint pain as a result of eating it. So earlier this year, a study was done by Kippenberg and his team, and it was published in, let's see, there's a journal here. I can send the link for it. I'm not exactly sure which journal it was published in, but it was looking at 420 lupus patients, and it reviewed the dietary changes that improve joint pain and muscle pain, promote weight loss, reduce fatigue, improve sleep, reduce nausea, reduce skin rashes and lesions. And in summary, the study found that cutting out dairy led to a 27% decrease in symptom severity and a 54% decrease in fatigue. Cutting out dairy and meat together, so essentially a vegan diet, led to a 26% decrease in symptom severity and a 63% decrease in fatigue. Eliminating processed foods led to a 26% decrease in symptom severity. So again, processed foods are going to contain a lot of sugar and a lot of gluten as well. According to the findings of the study I just mentioned, also the readings that I've done over the years by doctors who specialize in nutrition for autoimmune disease, as well as my own experience experimenting with diet, a whole foods plant-based diet which avoids gluten, soy, and dairy is the healthiest diet for patients with lupus. For myself, adopting a vegetarian diet made the most dramatic impact in my pain, my fatigue, mental clarity. And this is why I believe so highly in the power of food as medicine. So a whole foods plant-based diet has a variety of fruit, vegetables, gluten-free grains, nuts, seeds, and legumes. So it has foods that are minimally processed, which means that if it does come in a package, it's containing less than 3 ingredients on the label. And then foods that are also particularly beneficial are olive oil, walnuts, spices like turmeric and cumin. These all have really great anti-inflammatory properties. The next section that I want to talk about is movement, exercise, and rest. So depending on where you are in the course of your illness, exercise may sound really difficult or even impossible. And if that's the case, I invite you to first just focus on movement, making sure that you are moving your body in ways that feel good every day. So they can be things like walking, gardening, playing, dancing. Things that you enjoy and that feel good in your body are going to be the things that you can stay consistent with and to do on a regular basis. And that's going to make the most impact on your health. So exercise really helps mitigate a lot of the issues that lupus patients can get. So it helps in the long run to prevent heart disease, diabetes. It really helps a lot with mood and anxiety. And it helps promote better sleep, which is really foundational for people that have lupus. So the recommendation from the CDC for people that are able to exercise is that you're doing 150 minutes per week of moderate intensity exercise. And what that means is that you are keeping your heart rate up. You're not necessarily like sweating or out of breath, but you're keeping your heart rate elevated higher than you normally would if you were resting. And you might be a little bit out of breath and maybe just, feeling a little moist or perspiring a little bit. Basically, you're circulating everything in your body. You're really moving your body. They also recommend 2 strength training sessions a week for all of the major muscle groups in your body. And the Lupus Foundation has a really great low impact strength training workout on their website, which does work the whole body and is easy on the joints. So really the key for the strength training is to make sure that it is low impact, because we don't want to cause more stress or pain on our joints. But at the same time, by working and strengthening the muscles around the joints, we're really helping to protect them and keep them in good shape. So it's been confirmed that lupus is a stress-related disease, and many of us can trace our flares back to a stressful period in our lives, or even perhaps a traumatic episode that happened. And I want to invite everyone to do a brief exercise to really just take inventory of the factors in your life that are causing you stress. So you'll need a pen and paper to complete this exercise, and we'll write on each of these prompts for about 2 minutes each. So I'm going to go ahead and start my timer here. And the first prompt is going to be, what are the things, the people, activities, habits, thoughts, etc., in your life that you find depleting, that you find that they really deplete you? So go ahead and write for 2 minutes. I'm going to start my timer here. Okay, we have about 45 seconds left. Okay. All right, and the next prompt, we're going to write for 2 minutes on the things in your life that you find balancing. Start now. Okay, we have about 30 seconds left. Okay. And the final prompt is, what are the things in your life that cause you to be overstimulated? So it could be, for me, it's like social media or the news. But what is it for you? So I'll go ahead and start the timer, another 2 minutes here. Okay, about another 20 seconds. Okay. And the final one is I'm just going to ask you to reflect on, based on what you wrote, read it over and see if there's any changes that you can make in your life, just to decrease and mitigate the amount of stress that you're experiencing in the moment. So I'm going to go ahead and just start another 2-minute timer, and I'll ask you to write on that. Go ahead and get started. Okay, we have about another 40 seconds left. Okay. Thank you to those who participated in this exercise. I hope it was helpful for you. In the same vein of stress reduction, I want to bring up the topic of self-care. When many people think of self-care, they think of hot baths or spa days, but self-care can really be any activity that you enjoy and that leaves you feeling good after you take part in it. So starting a meditation practice and exercising regularly are all really good forms of self-care. And you have to first make sure that you are getting the basics. So good nutrition, restful sleep, and healthy social relationships are really the foundation for self-care. So I wanted to start here with a sleep hygiene and the things that you can do to really set yourself up to have a good night's sleep. So the first thing is setting up a sleep schedule. So making sure that you are going to bed and waking up at the same time every day, Monday through Sunday. So just because it's the weekend, you're not altering your sleep schedule too much. Having a wind down routine every night. So typically about an hour before bed, turning off your electronics, starting to turn down the lights in the house, participating in activities that are more calming and are helping to get you ready for the night of sleep that's ahead. So, reading a book, maybe journaling, basically not doing anything that's going to stimulate your mind or your body. It could also include like taking a hot bath or lighting a candle, something like that. Optimizing light is also really important. So Within about an hour of waking up, we should be going outside and getting natural light in through our eyes. So our eyes are receptors that send signals to our hormones and the rest of our body that let our body know that we are awake, that it's daytime. So optimizing light means getting nice bright light into our eyes early in the day, and towards the end of the day after the sun goes down, really starting to turn down the lights in the house, minimizing the use of screens. So that can be, phones and iPads and computers, but also even televisions. So some people will buy blue light blocking glasses. So blue light is the light that's emitted from our electronics, and they do send a signal to the body letting it know that it's daytime, it's time to be awake and to be stimulated. So these glasses actually block that light so that your body can start to wind down and start producing melatonin, which is going to help you to get a good night's sleep. Another great tip is cutting caffeine after noon. So really keeping your caffeinated beverages to the morning time. The amount of time that caffeine takes to break down in the body could really adversely affect your ability to get a good night's sleep. Reducing alcohol consumption is another one. There's a myth that alcohol helps people to sleep. Something like, oh, have a glass of wine and you'll sleep well. And while it might help someone to get off to sleep, usually it leads to more irregular sleep patterns and more wakings at night. So really reducing alcohol consumption is a way to sleep better and to sleep through the night. And then eating your evening meal earlier if you can. So this just gives your body more time to assimilate the food that you've eaten so that you can get a good night's sleep. Having strong social ties is an aspect of our well-being that can sometimes really be overlooked. In our busy day-to-day lives, we can sometimes view making time to hang out with friends as a luxury. And one thing I was shocked to learn is that social isolation and loneliness can be as bad for our health as smoking, and can put people at risk for mental disorders, can cause low-level inflammation in the body, leading to rheumatoid arthritis, lupus, and cardiovascular disease. And because lupus is an invisible illness, it can feel harder to get support from those around us. And so that's why it's really important to, in my opinion, join a support group to find other people that have the same challenges as you do. The LFNC offers a wonderful support group where you can, talk about the things that you're going through and get feedback, hear about what's working for other people, or just have a group of people that listen and who really get it. And if your doctor doesn't listen to you, you can always find one that does. I know that it's really hard to switch doctors, especially when you have a long history with someone, but it's also important that you have someone who you feel is really listening to you, is compassionate, and is helping you get your needs met. When I was first diagnosed with lupus, I wouldn't share with any of my managers or my coworkers that I had lupus because I didn't want them to view me differently or to see me as a liability. Over the years, I discovered that opening up about my illness allowed me to be better supported by my coworkers and have deeper, more genuine relationships with people. And that also included friends or people that I was dating at the time. So I think it's really important to focus on the quality of your friendships over the quantity. Perhaps you focus on a few good friends who really support you. They know about your illness. They know about the challenges that you go through. Also, staying in touch with people you worked with or have taken classes with is a great way to just have more relationships in your life that could possibly deepen and turn into more supportive long-term friendships. And introducing yourself to neighbors is another good one, just by way of, proximity, knowing the people in your neighborhood. And then really making the time to connect with your family members. Taking agency over our own health, changing ingrained habits, adjusting our lifestyles and our behaviors is really no easy feat. And I fully acknowledge that. But when we connect with our why, the reasons we want to make these changes, it can really help us to discover a huge well of motivation that perhaps we didn't even know was there. So connecting what gives us with what gives us meaning in life, the things that we're passionate about, our family and our faith. Faith, believing in a higher power or just believing in something greater than ourselves can really be a great resource for strength and motivation. For myself, when I was first diagnosed with lupus, my motivation was to get well because I didn't want to be a burden to my family. Getting my health back was probably the biggest motivator, and ultimately, it was the biggest gift that I could have given my family. So maybe you want to have more energy to pursue something that you're passionate about. You want to be able to run around the yard or play tag with your kids or grandkids. Whatever it is, something that brings meaning and purpose to your life is really important. And I encourage you to let that be the reason that you make the necessary changes to take better control of your health. These are some of the references that I covered today. So that study on plant-based dietary changes is listed here. And I'll send some links as well. I have written a guide on how to optimize your diet with lupus based on the findings in the study that you might find helpful as well. So thank you so much. Again, I welcome any questions or on any of the topics we covered today. And if it feels more comfortable for you to reach out to me one-on-one, I encourage you to just email me or send me a message. You can also send it through my website, which is just setarehhealth.com.
Great. Thank you, Setareh. That was wonderful. So much useful information. Really appreciate it.
Yes, of course.
Now we're going to start the Q&A portion of our session. And our first question is, what about eating salmon?
Yeah, so salmon is a really great anti-inflammatory food. It's also part of the Mediterranean diet, which is one of the diets that's really highly recommended to bring down inflammation and to support cardiac health. So I definitely think salmon can be part of a low inflammatory diet. It's not exactly vegan. I would recommend starting with more of a vegan-based diet if you're in a flare or you're having a lot of symptoms, and then perhaps adding things like salmon or sardines in later when you're feeling better and your inflammation levels are down.
Okay. See, the next question is, how common is inflammation and food reactions, even when lupus markers blood work doesn't show disease activity? However, pain symptoms persist.
So I would say if you're, the best person to ask about this is definitely your doctor. But in my opinion, I think if you are having symptoms of pain, it's also an indicator of inflammation. And most likely it would be helpful to take a look at the foods that you're eating to see if there is something that might be contributing to that. And again, the best way to do that is through an elimination diet. It seems really taxing to eat this way, to, oh my God, I'm removing gluten and dairy and all these things that I love. but just keep in mind that it's just for a period of 3 weeks. So you're just taking it out for a short period of time. You can think of it as an experiment, to really just see how you feel. And maybe there's other foods that you've kind of noticed, like, oh, when I eat that food, I think it triggers my symptoms. I encourage you to just take note of that and become aware, and eliminate that food for a while and see how you do with it.
Great. Do you recommend a plant-based or vegan diet for all lupus patients, or?
I recommend a diet that is going to be most optimized for your body. So really, again, like, it's really important, making note of the things that you're particularly sensitive to. A lot of times when someone is on a vegan diet, they're already avoiding like dairy. They're avoiding a lot of those things like meat that might be problematic, but I encourage you to just really personalize it to what your body needs and what you are particularly sensitive to that you shouldn't have.
Right. Okay. Our next question is, I've heard that meditation is also good for reducing stress. What do you think about it?
Yeah, meditation is wonderful. I wrote a paper last semester about lupus and mindfulness-based stress reduction, which is a method of usually it's a class that people take for several weeks on meditation, learning to just listen to the body, of being present. It really helps to calm the mind, calm a lot of the persistent thoughts that we have that can sometimes be negative in nature. So a lot of times these classes can be expensive. So there's definitely a cost to them, but there's actually one that I'm going to put in the chat here that's free, that if you're interested in checking out mindfulness-based stress reduction, you can sign up for this class and take it free of charge. There's also a
Great.
book that's written that's really helpful. It's a workbook that you can go through. But anytime you have the time and the space to learn meditation, you can see if it's something that can help you to manage your stress. It certainly has for a lot of people.
Great. And then our last question is, what about yoga?
Yoga is a really great mind-body activity that can really help you, again, to just tune in to maybe the symptoms you're having, or the thoughts that you're having about the symptoms. And it's a great way for you to get your body more flexible and calm the mind. I think it's really good all around. I really love Yoga with Adrienne. It's she's a YouTube, you know her.
I
Yeah.
do. Yeah, she's great.
Yeah. And she has like really short videos on YouTube that you can, kind of fit into your day. It's not an hour and 15-minute long, like, power yoga session. And I think it's really appropriate and really works well for people that have lupus.
Yeah, my daughter and I did her yoga sessions during COVID a lot. And
Nice.
she,
Yeah.
she has many different ones, different lengths and different thoughts. And she has that beautiful dog. And
Yes, Benji.
yeah, so
Yeah.
yeah, she's great.
Yeah, and I find her, she's like she makes yoga approachable, and she's funny, and it's just like, it's very easy to get into yoga with her. I'm
Yeah.
also going to share the link for this is the low impact exercise routine for lupus that's offered. So it's using calisthenics, so just like your own body weight, in order to build the major muscles in your body. So that's a really great resource as well.
Great. Well, I think that's it for us today. Thank you so much, Setareh. That was really informative, really interesting.
Oh, my pleasure.
Great resource for our lupus patients. And
Yay.
Our next lupus conference will be a Spanish one on October 1st. And follow us at our social media, Facebook or Instagram or Twitter for all updates, or check out our website, lfnc.com. Thank you. We'll see you next time, Setareh.
Thank you so much, Lori.
Okay, bye-bye.
Bye.